Alright, so yeah, this book is amazing. You know, probably can't really show you too much inside of it, but it has pictures, diagrams. I can't explain. If any of you guys have a lot of money and you're willing to use this product, I think it's around $200, right? It's around $200,
$250,
something like that. This book, they will go through it with you in like a week, 4 days or so, and this just helps.
It's it's not just the book that helps. It's like what they teach you, because let me tell you about the NCLEX. The NCLEX, it's probably going to be one of the longest, most stressful tests that you're ever going to take. And for them, they come in and it's not just you. They're just giving you regular knowledge and stuff like that. Just throw out information to you. They know you know this. So. They're giving you tips on how to take the test as well. Like, there was some things that that I didn't know on the test, but because I went through this program, I was able to narrow things down. Like, I think there was one technique that they taught us, which was expected and unexpected.
Exactly.
So it's like so let's say you have a multiple choice question, right? And you read it, and you still don't get it. You just look at the choices. You look at the choices, and then you see everything that is expected. Mm-hmm. Let's say this is supposed to happen. This is supposed to happen. This is supposed to. Let's say you're talking about let's say you're talking about diabetes. Mm-hmm. In diabetes, let's say some of the choices were diabetes can be related to hypertension. Mm-hmm. That's something that can happen. It can be related to low blood sugar. That's something that could happen. It could be related to fatigue and everything. That's something that could happen. And then it could be related to your eyeballs exploding. That's not gonna happen. So obviously, all those three out of the four, three of them are expected and one of them is unexpected. So that's something you could pick. I mean, that was a general question. You guys would probably know how to answer that one. But sometimes it would be harder questions where all of them look right and everything, but then you don't know how to narrow it down. That's one technique they teach you, so that way you can narrow it down and save time too.
Exactly. It's for example, if you're looking at a topic or so, like a certain type of hard problem, you look at the hard problem, you know the signs and symptoms of this problem. If they try to say what is abnormal in this patient, for example, you already know this. For example, you know the signs and symptoms of this disease or so. You're not going to pick the one that is expected. If you're looking at someone who has some sort of heart disorder, I don't know, and they're having chest pain, obviously they're going to have chest pain, for example. You're going to try to say, you're going to pick something that's going to be really abnormal, exploding chest, I don't know, something like that. So now we're going to show you books that we used outside of the book.
Yeah, these were just
for studying for the NCLEX.
These were just books that me and him, we went to Barnes and Nobles and we were like, oh, we have to get this.
Yeah.
So
I showed this in the first video.
I'm telling you, this book will take you to the. I'm sorry, but this. When we read these questions, we felt so dumb. I mean, look,
you feel dumb.
Kaplan NCLEX-PN book. This is 2012, whatever. But if you're planning on getting the book.
They have another one for this.
Yeah, they have 2013, 2014.
They're definitely not gonna make that much changes. But who knows?
But I'm telling you, this teaches you. This is also teaching you stuff on how to answer questions and everything. But I'm telling you, the questions in this book, it's ridiculous. They make you think.
Me and him knew that everything all the question sorted styles that we've been learning was almost pre-K level.
It was.
Tell me now.
It was so
pre-K level.
Baby,
this Kaplan takes it to college level. Can you imagine? So it's almost just reading this takes the way you critically think, amazingly. So it's almost you guys need to get these kinds of books from an earlier stage. You're gonna try to say halfway through the program, that kind of thing. You're always almost studying tips, that kind of stuff. Get those. Get
this book. This was. I'm telling you, this was definitely the game changer book for us. We read it and. It was wow. Even our instructors were reading these questions and they were like, oh wow, this is crazy. It was crazy. And then there was another book that I got, for on the go. If you're not always gonna have these big books that we just showed you.
Yeah, me and him borrowed these books back.
So I got this book. This one is NCLEX-PN Flashcards, and this book, it's really good. It's basically questions that. Basically question and answers, and then the rationales on the back.
Exactly. So you read a question,
and then
right behind it
are the answers and the rationales.
Right there. Exactly.
So this is a really good book in the sense that you want to read questions real quick, and they're multiple choice. Not all of them multiple, but they're multiple choice. Yeah. There's math,
fill-ins.
There's fill-ins, and then there's
select all that.
Yes, select all that apply.
So you can use this on the bus. You can use this when you're like chilling with your friends, or chilling somewhere else. I don't know.
Yeah. So this is good too, and then it has if you want to make your own flashcards, it has like some spare ones in the back too that you can use and everything and stuff like that. Like blank ones, you want to make your own or make references, you can do that.
Yeah.
So yeah, that's
pretty cool. Which one? This book?
No, that's the drug. I mean, you guys probably already.
I mean, yeah, this is what we used.
Drug handbook.
They have too much information.
I mean, you don't really need to use that unless you actually have to look up a drug.
This is what we
used
like that in clinicals, so it was pretty good. Our instructor always wanted us to have this on the floor, like whenever we were looking at a patient's medication history or whatever, or the medication that they are taking. Use this. She wanted us to always have this with us, and use this as a reference, basically. So.
Yeah. So
so tips for the NCLEX.
Yeah, for the NCLEX. For the NCLEX.
How did you study? What did you do? What I mean, what helped you? I guess.
Now for the NCLEX, again, the one thing you should just be sure about yourself, that you should just let yourself know right before you start taking the NCLEX, is that you're never gonna feel like you know everything. Just the one thing you should just do is study as much as you can until the point where you're like, okay, I think you're not gonna ever say I know everything. I know everything. Ask me anything about any topic, blah blah blah. Because the NCLEX is crazy, but study enough where you're confident in a way that you can at least take on any question that's asked at you or something like that.
And if any of you guys, for example, like if you're already approaching your date, maybe you schedule it too early, for example, and you're having doubts, you're like, I don't know, maybe I should study for a bit. you should at least maybe change your date once, maybe. Yeah. At best maybe once. Once you start changing dates all over again, you're overthinking it. You need to just be confident. Almost like, you did everything you could at practice. You need to just go in and just try it out. Just take the test. Because in
my case, I had no choice but to switch dates, was because I was having issues with passport and everything for identification for take the test, so I had to switch my dates. And I ended up taking it late in August when the program, when we finished with our program in
June or so.
Yeah, in June. So I was I had to study all that time up until that day. I was the last person in my class out of a class of 28. I was the last person to take the test, and the instructor put my instructions and everything, and the coordinator program put the pressure on me. It was like, oh, you're the last person to take the test. It's all on you. You pass. It's gonna be great. Just take your time. Don't overthink it. At the end of the day, you have to think about it as just another test. Just think about it as another. You're gonna come in. You're gonna fingerprint you everything, ask your identity. You're gonna sit down. You're gonna start your test. And once you start, you just gotta be cautious of time. Think about your questions. Think about questions, but don't take too long to think, because you only have, I think, 5 hours.
5 hours. Yeah.
5 hours. 5 hours to do either 85
questions. Yeah. 85
to do either 85 or 205 questions.
And I mean, the thing also is that our instructors also. You had a different teacher.
Yeah, I had.
She basically was like, obviously up to that point, you've done so many questions, your head is gonna explode. You get what I'm trying to say? You almost feel like you're knowing too much. You need to just, if you know how to sort of select and deselect your questions, figure out, cross out which one is wrong in your mind, you're gonna approach the test in a better way, that kind of thing. You need to do as much questions as you can. I don't know how much they recommend.
They recommend,
it has to be 1,000.
In our last year, they recommended at least,
you said senior year?
200. Yeah, senior year. They recommended at least 200 a night.
Oh, 200. I think she said 100 a night.
She said between 100 to 200 questions a night.
Oh man.
I'm gonna be honest with you.
We didn't do that.
Yeah, but
we're constantly doing questions. I mean, no one is really recording how many questions they did each day, but we kept on doing questions throughout the day. We don't really remember. So
and try, like, I know you're gonna be tempted to not to do questions on things that you know, but try to focus on stuff that you're not sure about. I'm telling you, that's one of the best. Because I remember when we had to do a predictor test, and it told me that that I was lacking in maternity and pediatrics. I was like, oh, okay, maybe I should just start going over that more. Exactly. So I did that, and but that didn't necessarily mean that I was gonna fail on my NCLEX, because you don't know what's gonna be on the NCLEX. But it just let me know that, okay, I need to focus more on these things. So let me just start focusing a little more on that stuff. I still did everything. I still did maternity meds. I still did med surge and pharmacology and nutrition and all that. But I just focused a little more on maternity and peds, so that way I can be like, okay, now I got this, and I'm okay with everything else.
So it's like, for example, like if you any people who do take predictors or anything, and you see your strengths and your weakness, if you already know throughout nursing school that you're already really good in one subject area, like med surg or pharmacology, whatever, and you're really horrible in maternity, like do more questions around that area. You're gonna try to say, pretty much, yeah.
Yeah, that's pretty much. I mean, other than that, it's just you studying. I mean, me and this dude every day over the summer, like we had no summer. Every day I'd just come over to his house. We would just bang out questions, just throw out facts to each other and everything and stuff like that. Go over question after question after question, and make sure that if you get a question wrong, that you don't just skip it. Make sure you know why you got the question, because at the end of the day, right?
It always bugged me when I didn't know.
Yeah, like at the end of the day for nursing school, for me, at the end of the day, it wasn't about me. You could pass or fail a test. Anybody could be great at taking tests. Me, I don't think I'm that great at taking tests. But I always make sure that when I got a question wrong, I understand why I got it wrong. It's just once you learn to understand instead of you actually just learning to take a test, you retain it better. So it's like once you actually go and look up something, or you're curious about something, you retain the knowledge better. So if you get the question wrong, don't panic. Look at why you got it wrong. Try to understand the reasoning behind it, and then once you understand the reasoning, you're probably going to get the question again, but in a different format, and then you'll be able to understand, oh, wait, I had a question before like this, because there's been so many questions where they're just thrown at us, and it's like, wow, we've already had this question, or I remember getting this question wrong.
And that was the thing. After we graduated, and we kept on doing clinical up until we took our test, we kept on doing questions after question after. It's almost like things started getting repetitive. Whenever we started seeing a question about diabetes, I already know what it's going to be about. Whenever we started seeing a question about cardiovascular, I already know what it's going to be. Or you're already going to get an idea of the question. You're going to know where it's going, where it's headed. So it's all about obviously doing as much questions in each topic as much as possible. But you need the foundation of the topic, of the disease, that kind of thing to help you out.
At that point, when you start, when things start becoming a little repetitive, you've moved to your weaker points, and you've mastered your weaker points. At that point in time, then you can be like, okay, maybe I'm ready to take the test.
Confident enough to take the test.
And when it comes to you, like a day or two before the test, I know it's going to be really hard for you not to
all of our instructors said, the day before the test, do not read anything, relax.
Don't try to sneak anything in. Be like, maybe I should go over this because usually
this last part.
Because usually when people try to do that, it doesn't happen with a lot of people, but usually when people try to do that, they try remembering that more, and it sometimes makes them deviate from like other things that they've known already. So it'll be harder for them to recall that information when they get a question.
Exactly. So that's pretty much our experience.
Yeah, I mean,
what else is there to go?
Other than that,
anybody out there, it's hard. We know. Any adults out there, we know your situation is definitely harder than high school students. We came from a pretty good program. So
yeah, I mean, it was hard. Like we missed out on a lot of stuff. Like basically, the 28 of us became like just our own group throughout high school, and it was crazy, but we made it work.
So. good luck out there. You know, we hope you guys do well.
Future nurses, hope to see videos one day of you